Morning. So welcome back to yet another reading live session. This is me Vandana PS joining you from Nidus Academy. So in this video, I'll be dealing with, as usual, a sample question from part B, as well as I'll discuss about part A in detail. Okay, a self-prepared material for part A. So yeah, I'll give you 2 minutes for the preparation of this sample question from part B. So shall we do it? So here comes the question. All right. So welcome back. Good evening once again. So how is this question? I'll read the question, then we will discuss the answer. The standard explains that in the case of living donors, okay, the standard explains that in case of living donors. Yes. So what are the keywords from the question? Hi Anida, good evening. Yes, Ezekiel, good evening. It's not readable, right? Is it not readable? Okay. Anyway, so yes, I'll read the question so that you can listen properly. The standard explains that in the case of living donors. Am I audible? Not audible. All right, Sanila. Am I audible, guys? Okay, Ezekiel, am I audible to you? Am I audible? Audible. Okay, thank you, dear. Thank you. So anyway, the standard explains that in case of living donor. So my keywords from the question: standard, then case, and donors. So these are my keywords from the question, and it is a different type of question. Usually deal you can see a lot of, not lot of, especially you can see which category of question is this. It will be very clear in the question, but still in this question it is not mentioned. Okay, what is not mentioned? Which category? That category is not mentioned here. As well as in the title also, it's nothing mentioned about the category. Requirements in relation to the medical and social history of prospective donors. Okay, so let me ask you a question. Which category of question is this? Let me know in the comment box. Which category of question is this? This is the category of question. Whether this is a guideline or a manual or a policy or email, notice or a memo. Which category? Is it comes under the first category or the second category or third category? This category. Yes, Vishwam, hi. Hi Amy, good evening. Okay, Ezekiel, notice. Why this is a notice, dear? Why? Why you are saying this is a notice? Why this is a notice? The standard explains that in case of living donors, as you can see here, these are lot of instructions mentioned. I don't know whether you guys remember. If it is a guideline, the guideline will ask you 3 questions. What are the questions? The question will be framed in these 3 questions. Then it will be a guideline, or you can see a lot of words in this extract like must, should, have to, adhere, follow, obey. Okay, in the words yes. So actually this is not a notice. We can connect with a guideline. This is actually a guideline because it is a lot of instructions mentioned. See, the interview must be conducted. So this is an instruction, must be conducted. Interview must be conducted no more than. So these are instructions mentioned, so that you can categorize this into the first category, which is guideline. Then what are you reading for in a guideline? Then what are guidelines? Endana guidelines? Let me know in the comment box. What are guidelines? What are guidelines? Guidelines, which means a set of rules and regulations that someone should follow. So here they have mentioned some requirements, some rules, some regulations that they should follow. Okay, so these are guidelines, and we are reading for the details. What are the instructions mentioned? What are the principles mentioned here? What are the details? So that is, we are reading for the details. Then which sentence is important in a guideline? Always the first sentence is important. So actually the first sentence is from here and it's ending in here. Okay, so I'm reading the options now. So option A, collection can. Yes, Roshna, set of rules and regulations that someone has to follow. Very good, dear. Very good. Excellent. Okay. Yeah. A collection can only take place once their history has been taken. So my keywords. So what are the keywords? Collection, only, then history. So these are my keywords from the question. And I've told you, I don't know whether again you guys remember that or not. Whenever you see a word like only in any of your options, or whenever you see a word all in any of your options, or whenever you see a word always in any of your options, please do check whether it is mentioned in the paragraph or not. If it is not mentioned, you can eliminate that particular option, right? Yes. So collection can only be take place once their history has been taken. That is option A. Option B. A therapeutic goods order supersedes all other collection requirements. So, therapeutic supersedes all. These are my keywords from Second option, and options are little bit lengthier. Option C, interviews must outline everything that occurred at least once 1 month prior to collection. So my keywords, must, everything, then prior. So these are my keywords from the third option. Okay, then so let me know in the comment box. I hope you guys have already done this question, so please let me know what is your answer. Answer and then on the comment cheyamo. Please let me know what is your answer for this question. Interviews must outline everything that has occurred at least 1 month prior to collection, or a therapeutic goods supersedes all other collection requirements, or collection can only take place once their history has been taken. Which is your answer? ഏതാണ് നിങ്ങളുടെ ആൻസർ? I'll read the paragraph, then please do comment, okay? Requirements in relation to the medical and social history of prospective donors. So, requirements, the needs, the instructions, principles, regulations. Okay. In case of a living donor, the blood components, cells or tissues must only be collected from a living donor with whom an interview to obtain the donor's medical and social history has been conducted and recorded in accordance with the following requirements. So from the first para, please do listen properly. From the first para, very clear, this is a guideline. Why? In case of a living donor, എന്തൊക്കെ കളക്ട് ചെയ്യുന്ന പറയുന്നത്? blood components, cells or tissues must. Okay, so must. See, the word is mentioned very clearly. നിർബന്ധമായി കളക്ട് ചെയ്യണം. എപ്പോൾ? Only be collected from a living donor with whom an interview to obtain the donor's medical and social history has been conducted. So from the first sentence is important in the guideline, remember. So you can trace towards option A, maybe option A. See, that only is directly mentioned there. Then, so what are the following requirements? What are the adherence? So option A, the interview must be conducted with the donor or guardian, next of kin, by a trained interviewer, and should be a face-to-face interview. So interview collect cheyanam and it should be a face-to-face interview. That is option A. Again, you can trace towards option A. Yeah, you should conduct the interview. Second requirement endana? Interview must be conducted no more than 30 days prior. 30 ദിവസത്തിന് മുൻപോ. Before, no more than 30 days before. Or 30 days after collection of the blood components, cells or tissues, and must occur prior to any release of the relevant product from quarantine, unless otherwise specified in another current therapeutic goods order that applies to relevant products. So these are the lines or the sentences mentioned here. Okay, so let me know your answer please in the comment box. What is your answer? In the answer kittekune. Okay, already we are sharing it in the YouTube, dear. Okay, so Anita, already we are sharing this particular video in the YouTube. You can check it out, okay? Yeah, okay, Sanila, it's option A. Yes, Reshma, Roshna, Vishwam, it's B. Okay, any other answers? Where I think answers കിട്ടിയിട്ടുണ്ടോ other than option A and B? C undo? Anyone with option C? No. Okay, so I think you guys can eliminate option C very clearly, right? Or very easily you can eliminate option C. Why? There is no answers. Option C. Interviews must outline everything, which means whatever they need. Anything, everything. So where is everything mentioned? Interview must outline, nirbandhamayittum outline cheyanam. They should outline everything that has occurred. Where is it mentioned? Everything that is occurring. Okay, you should collect what എന്താണ് അവർ പറയുന്നത്? Donors medical and social history. Medical and social history മാത്രം മതി. Nothing mentioned about everything. So not mention. And one more reason to eliminate option C, occurred at least 1 month prior to collection. See, very clearly it is mentioned here, no more than 30 days prior. So contradictory alle. So either you can eliminate it is because it is not mentioned, or it is contradictory, opposite option. And what about option B? A therapeutic goods order supersedes all other collection requirements. Where is it mentioned? It is mentioned here in the last line, current therapeutic goods order that applies to the relevant product. എന്ന് വെച്ചാൽ എന്താ? Current therapeutic order that applies to the relevant product എന്നാണ് പറയുന്നത്. So no connection with the question actually. We can say it is contradictory or opposite option. Where is it mentioned? It supersedes all other collection requirements. ആണോ? No. Contradiction. Opposite ആണ്. Actually, the answer is option A. Collection can only be taken once their history has been collected, because otherwise, if the patient has any problems or any complications or any disease conditions, definitely we can't collect the requirements of this particular blood component cells or tissues. It will be difficult. Okay, so answer is option A. Collection can only be take place once their history has been taken. എന്താണ് collect ചെയ്യേണ്ടത്? Once they are only be collected from a living donor with whom an interview to obtain the donor's medical and social history. That is the correct answer. Clear? Answer is option A. Very good. Yes. Right. Okay. So Ezekiel, Sanila, Reshma, Roshna. Very good. Very good, Roshna. Okay. So that's all about that. So I'll just summarize about part B today. So we have 6 questions in part B. Clear? 6 questions. What type of question? In the type of question ആണ് multiple choice questions with 3 answer options. ആണോ? Yes. Okay, what are the category? 3 category. Guideline, then manual or policy or manual comma policy, then third category email, memo, notice. Okay, so this comes under guideline and we are reading for the details. First sentence is important and you got the answer from first sentence. Okay, so that's that. So now we are moving to the second material, part A. So we have a very new self-prepared material for part A, that is CRPS. Okay, complex regional pain syndrome, CRPS. Okay, and I hope you have done this material. ചെയ്തിട്ടുണ്ടോ? Okay, so anyone attending this session for the first time, please do take the printout of the material from Needhu's Academy Reading. Okay, so we have a page called Needhu's Academy Reading and you can download the materials from there, from that particular page. Okay, and we upload the materials before 11 a.m. in the morning. Okay, so please do take the printout of the material, do the material and enter the live session. Okay, so yes, let's read the material, then find out what are the important keywords mentioned. And let's move to the question answers. Okay, so I'm just reading the material. Complex regional pain syndrome or CRPS. It is a condition that causes pain, changes in color and other symptoms in certain part of your body, usually in your extremities. Your extremities include your arm, leg, hand or foot. The symptoms of CRPS can greatly impact the function of your affected limbs, sleep, daily activities and your mental health. Experts believe that CRPS occurs as a result of dysfunction in your central or peripheral nervous systems. Your central nervous system consists of your brain and spinal cord. Your peripheral nervous system relays information from your brain and spinal cord to your organs, arms, legs, fingers and toes. The abnormal functioning results in an overreaction to pain signals that your nervous system can't shut off. There are 2 subtypes of CRPS. Type 1, this type occurs without nerve damage. It happens after an illness or injury that didn't directly damage nerve. Type 1 was formerly known as reflex sympathetic dystrophy. Type 2, this type occurs after non-nerve damage. It was formerly known as 𝐻𝐿GA. Okay, yeah, 𝐻𝐿GA. Then CRPS can also either be acute or chronic. It is usually treatable. Then CRPS more commonly affects adults and children. The peak onset is around 40 years of age. CRPS affects people assigned female at birth more often than people assigned male at birth. Then about 66% to 80% of cases occur in people of European ancestry. CRPS is relatively rare. It affects about 2 lakh people every year in the United States. So these are my keywords from text A. Okay, and you guys know it's very important to underline the keywords. So what are keywords, which means endana keywords nu parna? So keywords which means important words from the text. Okay, so when you read a text, when you analyze a text, definitely you can collect a lot of keywords from the text. നമ്മൾ വായിക്കുമ്പം നമുക്ക് തന്നെ അറിയാം ഈ കീവേഡ് ഇമ്പോർട്ടൻ്റ് ആണ് അല്ലെങ്കിൽ this word is important. Okay, so we are underlining certain keywords or important words from the text because that keywords or those keywords will help you to find out your answer. Clear? Then from text B, signs and symptoms. So I can summarize text A. Summary varne. What is the summary of text A? What is the gist here? So what is this condition? CRPS endana. Okay, what are the causes of CRPS? Then what are the different types of CRPS? So that is a summary of text A, right? Then text B. Signs and symptoms. How severe and how long symptoms of complex regional pain syndrome or CRPS last varies from person to person. Symptoms of CRPS typically start within 4 to 6 weeks after an injury, fracture or surgery, but they can develop without a non-cause. The most common and prominent symptom of CRPS is pain. The pain is constant or intermittent and is burning, stinging or tearing sensation. It is often deep inside your affected limb. Sensory changes are also common in the affected area, may include, so these are the points. What are the sensory changes that can occur? Increased sensitivity to painful stimuli. A pinch may feel more painful than usual. Then feeling pain from stimuli that are usually not painful, such as just touching your skin. Then numbness will be there. Other symptoms of CRPS in the affected area include skin swelling will be there. Decreased function in your affected limb. You may experience a decreased ability to move your affected limb and or increased stiffness. You may also have difficulty placing pressure on your affected limb or joint. Then changes in skin temperature. Then changes in skin color, skin texture, changes in nail and hair growth. Then since symptoms of CRPS usually improve over time, it is earliest for healthcare providers to diagnose it in the early stages. It is important to see a provider soon after you experience symptoms of CRPS. Okay, so these are my keywords from text B. Oro lining in a watch, it can all time on no. Okay, so please don't go for a slow reading each and every line, understanding what is the meaning. We don't have this much time. Okay, so please do read it fastly as much as possible and underline the keywords, then go to the questions. Okay, so so summarizing text B. So what is in text B? Signs and symptoms, as the title itself indicates. So what are the sensory changes as well as other symptoms of CRPS mentioned? Okay. Then text C, there is a diagram, a pictorial is mentioned here. So diagnosis of CRPS, engane identify cheyam. Step by step process is mentioned. It is very clear. See, this arrow mark indicates step by step procedures, process of diagnosis. What is the first step, second, third? So this is all about step by step procedures for the ascertaining or identification of CRPS. Pain control plus physiotherapy, then tricyclic antidepressant, that is gabapentin, then opioid, topical capsaicin, improved pain and function, continue conservative management, inadequate response, diagnostic sympathetic block, then good response and poor response will be there. Series of 3 to 6 sympathetic blocks plus physiotherapy, series of somatic blocks plus physiotherapy, improved pain and function, early sympathectomy. Severe pain persists, improved pain and function, continue conservative management. Okay, then psychological evaluation and plus physiotherapy, relaxation techniques will be there. Biofeedback, improved pain and function, continue conservative management. Then severe pain, consider neuromodulation as well as intrathecal baclofen. Okay, baclofen, name of a medicine suppose, for dystonia. Anyway, so these are the keywords from text C. Hi Jisa, good evening. Hi Vasant, good evening. Okay, so text C already it is all about what are the different steps of diagnosis. Okay, procedure of diagnosis. Yes. Text D, it's all about the complications. What are the ramifications, complications, difficulties, risk factors. Okay, yeah. Tissue wasting or atrophy. The skin, bones and muscles may begin to deteriorate and weaken if you avoid or have trouble moving an arm or a leg because of pain or stiffness. Muscle tightening, or that is contracture. You may also experience tightening of the muscles. This may lead to condition in which the hand and fingers or the foot and toes contract into a fixed position. As CRPS affects the nervous system, it can lead to a wide range of complications throughout the body. So what are the complications? What are the issues that have been linked to CRPS include chest pain, changes to the way body perceives and manages pain, problems with thinking and memory, lethargy, fatigue and weakness, rapid pulse and heart palpitations, breathing problems, fluid retention, muscle weakness, rashes, mottling and other skin problems, urological problems such as difficulty urinating, incontinence, gastrointestinal problems including nausea, vomiting, diarrhea, symptoms of the irritable bowel syndrome or IBS, then gastroesophageal reflux, low cortisol levels and hypothyroidism. Okay, so likewise you will get 2 minutes. Actually this is little bit more faster. I can say it is my medium speed. because you just want to understand whatever I'm reading. So that is why I'm just going like, okay, in a medium speed. This is not a very fast speed. Okay, speed it's not rapid. It's not rapid. Okay, so actually when you read, what is speed reading or skimming, which means half of the portion, majority of the portion will be in your mind. Okay, and rest of it is articulating like this. It is a condition or pain symptom, certain part of the body. This is called skimming or fast reading. Okay, so yes. Anyway, coming to the questions. Jumping to the questions. Okay, first question was little bit lengthier, but a very nice question. The succeeding steps to be taken by a patient if he demonstrated little response towards initial curative techniques. Okay, so what is the first step? After reading or after skimming and scanning, you can go for reading the question. After reading the question, what is important? You should underline certain keywords from the question. Question and the keywords underlines here. Okay, so what are the keywords from the question? Succeeding, then demonstrated, initial. So these are my keywords from the question. So where is it mentioned? Let me know in the comment box. What is your answer? എന്താണ് ആൻസർ നിങ്ങളുടെ? First one, the succeeding steps to be taken by a patient if he demonstrated little response towards initial curative techniques. On the comment ചെയ്യാമോ? What is your answer for the question number 1? Okay, so for the freshers, please do mark. എന്താണ്? You can answer in this particular letter whether this answer is, where is the answer is from, എവിടെ നിന്നാണ് ആൻസർ കിട്ടിയത്, whether it is from text A, B, C or D. Yes, okay Anju. Yes, Jissa, Amy, what about others? Yes, please do comment your answers. First one, succeeding steps to be taken by a patient if he demonstrated little response towards initial curative techniques. Yes. Okay, 𝐬𝐬𝐀𝐝. Yes. It is a correct answer which is mentioned in text C. Okay, succeeding steps. Text C is all about the steps, the procedures of diagnosis. So what are the procedures? So succeeding step, which means what are the further steps? This is the first one in the diagnosis of CRPS. So what is the first step? Pain control plus physiotherapy. Then what is the succeeding? You can go for some medicines. Okay, so that is mentioned in text C. Then, okay Preeta, yes, Binila, very good, text C. Second one, what are the gastrointestinal issues associated with CRPS? So my keywords, gastrointestinal issues, CRPS, yes. Issues are ramifications, okay, or complications. Then risk factors, problems, difficulties. So where is it mentioned? Yes, answer is mentioned in text D. Yes, very good Jissa. Yes, Binila, Aishwarya, yes, 𝐿𝐴𝐴, Megha, Amy, Sanila. Excellent. Okay, answer is mentioned in text D. എന്താണ്? Complications, issues, കണ്ടോ? Okay, ഇനിയിപ്പോൾ ഇഷ്യൂസിന് വരെ അവരെന്ത് ചോദിക്കും? Maybe they will ask you regarding what are the ramifications, what are the complications, what are the risk factors, what are the problems, what are the difficulties they are facing. Okay, what are the after effects, what are the negative impacts? See, a lot of synonyms will be there. Alright, so that is D. Third one, general classifications of CRPS. So classification is my only keyword from third one. Yes. Okay, Aishwarya, yes. Preeta, Anju, text D. Very good, very good. What about third one? Classifications, divisions, subdivided. എന്നൊക്കെ പറയാം. Okay, yeah, categories, കണ്ടോ? Different types. Yes. So the classifications mentioned in text A. So what are the different types? What are the classifications? So two subtypes of CRPS. What are they? Type 1, type 2. Okay, so answer is mentioned in text A. Yes, okay, Preeta, Sanila, Amy, Jissa, Binila, Megha, yes, and Anju, 𝐿𝐴𝐴, yes. It is text A, very good. Fourth one, common alterations in the skin texture that can be seen in the patients with CRPS. So common alterations, skin texture, these are my keywords. Alterations in എന്തൊക്കെ ചോദിക്കാം? Changes, okay, modifiable, okay, agile, 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 okay, it is agile, it is changeable, modifiable, alterations, alternative. So that is common alterations. Yeah, what about fourth one? Yes, fourth one, it's not text A, common alterations in the skin texture that can seen in patients with CRPS. അതെവിടെ പറഞ്ഞിരിക്കുന്നത്? Alterations, changes. A ആണോ? Where is it mentioned in text A? It can affect skin texture. Yes, Anju and Ezekiel. Aishwarya, yes, Preeta. Answer is mentioned in text B. B is the correct answer. Where is it mentioned in text B? Common alterations in the skin texture that can seen in patients with CRPS. Discolorations ഉണ്ടെന്ന് പറയുന്നുണ്ടല്ലേ, കണ്ടോ? Changes in skin color, skin texture. Okay, skin temperature. So that is in text B. Okay. Yes, Aishwarya. Okay. Okay, Vinila, it's not A dear, it's B. കേട്ടോ, B ആണ്. Yeah, then fifth one, reasons behind the occurrence of CRPS. So reasons occurrence CRPS. ഈ കണ്ടീഷനെ പറ്റി എവിടെ പറയുന്നത്? Where is it mentioned? Regarding the condition, what is CRPS and what are the reasons of the condition? Occurrence. Okay, actually it's mentioned in text A, the condition. Okay, and what are the reasons mentioned? Experts believe that CRPS occurs as a result of dysfunction. Kando? So that means it is mentioned in text A. Yes, Binila, very good dear. Okay, Amy, Anju, Aishwarya, Ezekiel, yes, Aishwarya, Mohan, yes, Preeta. Okay, so answer is in text A. Sixth one, what all negative outcomes can be expected if CRPS affects the nervous system? So negative outcomes expected. Kanda? See how different it is? Okay, അവർ പറയുന്നു complication, പിന്നെന്ത് പറഞ്ഞു? Issue, പിന്നെന്താ? Ramification. So here it is mentioned negative outcomes, negative impacts. Okay, so where is it mentioned? Without even reading, we can answer the question. Alle, that is in text D, ano? Yes, it is in text D. Sixth one, text D. Okay, Ezekiel, it's not A dear, it's D, ano, D. Sixth one is D. What are the negative outcomes, complications? Alle, it's all about the complications issues. Okay, then seventh one, when should one follow conservative management? Management, where is it mentioned? They should follow some management options. It is in text C, alle, ano? So what are the management options mentioned? See, after diagnosis, they are following the step-by-step procedure. Okay, so that is in text C. Yes, okay, Megha, very good, Megha. Text C, ano? Yes, okay, Preeta, text A edano, fifth one ano. Okay, Aishwarya, it's not A dear, it's C. Seventh one C, ano? Okay, Amy, correct answer. So now 8 to 14 short answer questions. Okay, so still there are confusions among students that എപ്പോഴും ഒത്തിരി സ്റ്റുഡൻസ് എന്നോട് ചോദിക്കുന്നുണ്ട്, മാം 4 words എഴുതാവോ, 5 words എഴുതാവോ? No, you can't. Okay, you shouldn't. എഴുതാൻ പാടില്ല. Don't write more than 2 or 3 words. Because എന്താണ്? Why? Because very clearly they have mentioned here you have instruction. അവർ ഇൻസ്ട്രക്ഷൻസ് തരുന്നുണ്ട്. അപ്പോൾ നമുക്കൊരു ഡൗട്ടാണ്. ഓക്കെ, സപ്പോസ് ഐ എം റൈറ്റിംഗ് 4 words, ഈവൻ ഇഫ് ഇറ്റ് ഇസ് റൈറ്റ്, ക്യാൻ ഐ ഗെറ്റ് ദ മാർക്ക്? നോ, യു വിൽ നോട്ട് ഗെറ്റ് ദ മാർക്സ്. വൈ? വെരി ക്ലിയർലി instruction is mentioned here, 2 to 3 words maximum. Okay, so yeah, what steps shall be taken if the initially administered medicines show meager response? So step, initially, then response, these are my keywords. Yes, അപ്പോൾ സ്റ്റെപ്പാണ് ചോദിക്കുന്നത്, സ്റ്റെപ്പ് ബൈ സ്റ്റെപ്പ് പ്രൊസീജിയേഴ്സ്. അഗൈൻ ടെക്സ്റ്റ് സി ആണെന്നുള്ളത് ഷുവർ ആണ്. Okay, so what is the step shall be taken if initially administered medicines show meager response? Initially administered medicines ഇതാണ്. Okay, it is showing meager response എന്ന് പറയുമ്പോൾ inadequate response. And what is the step? Diagnostic sympathetic block. Okay, answer is diagnostic sympathetic block from text C. Okay, any doubts? കിട്ടിയായിരുന്നോ ആൻസർ? വിച്ച് ഇസ് ഡയഗ്നോസ്റ്റിക് സിമ്പത്തറ്റിക് ബ്ലോക്ക്. ദാറ്റ് ഇസ് ദ കറക്റ്റ് ആൻസർ. ഓക്കെ, ദെൻ സെക്കൻഡ് ക്വസ്റ്റ്യൻ, വിച്ച് കണ്ടീഷൻ ഇസ് ഡിഫൈൻഡ് ആസ് ദ ഡിറ്റർമിനേഷൻ ഓഫ് സ്കിൻ bonds and muscles if someone has trouble moving an arm or a leg because of pain or stiffness? Which condition is defined? We need a name of a condition. ഒരു ഡിസീസ് കണ്ടീഷൻ ആണെന്നുള്ളത് ഷുവർ ആണ്. Yeah. So what is the answer? Ninth one. One comment cheyde. What about ninth question? Which condition is defined as the identification, determination of skin, bones and muscles if someone has trouble moving an arm or leg because of pain or stiffness? Which is your answer? Edana? Ninth one. What about ninth one? No answers. Kitila? Okay, so answer is either you can write, yes, tissue wasting, or you can write atrophy. Both are correct. Kanda, this is a condition. So either you can write tissue wasting or you can write atrophy. Endana? The skin, bones and muscles may begin to deteriorate and weaken if you avoid or have trouble moving an arm or a leg because of pain or stiffness. Okay, that is atrophy, or you can write tissue wasting. Either atrophy or you can write tissue wasting. Hi Tony Francis, good evening. Okay, yes, that is the condition. 10th one, which part of the human body is considered as extremities? So we need which part, human body, considered extremities. Yes, either part na. Okay, what part of the body? It's very clearly they're asking what part of the body. What are the parts? You can write more than 2 words or 3 words. Sorry, 1 or 2 words. Okay, more than 1 or more than 2 words. But very clearly asking what part of the body. That means even though we have a lot of answers here, you can write only one. That's enough. Okay, so what is the correct answer? Okay, Roshna, atrophy. Very good, dear. Correct or not? Yes, Binila, arm, comma, leg, comma, hand. Yes. And even you can write arm. Correct or no? Okay, if you write ARM, arm, it's correct. If you are writing leg, correct. If you are writing hand, it's also correct. Or if you are writing foot, that's also correct. Okay, yes, arm, leg, hand, foot. Appa 4 words. Okay, it will be 4 words so that you can remove 1 word. Okay, Ezekiel? It will be otherwise 4 words. You can write arm, comma, leg, comma, hand, or you can write arm, comma, leg, comma, foot. Okay. Yes. 4th one. What does IBS stands for? Endan IBS? What is IBS? Which means very simple question. Even though if you have no idea, you can answer it. Enda? Ninga ariyam. Alla irritable bowel syndrome. That is IBS. Where is it mentioned? I think I've seen this word in text D. Somewhere in the bullet. Yeah, here. IBS. That is irritable bowel syndrome. See? 3 words. Irritable bowel syndrome. And 12th one, the chronicity of or which normally demands one to have neuromodulation. Actually, there is no space. Okay, I think there is a typo in the question. Neuromodulation. There is space. There is no space actually. Neuromodulation is actually a single term. Okay. The chronicity, which means the severity. Okay. Or which normally demands, again, severity demands one to have neuromodulation. Yes. What is the answer? 12th one. Dystonia. Ano? Is it dystonia? Chronicity or which normally demands one to have neuromodulation. So what is the reason for their having neuromodulation there? It's not dystonia, I think. Yes. Okay, Aishwarya, arm, leg, hand. Yes, it's not dystonia, guys. Where is it mentioned? Text is CLA. Yes, text is CLA. Neuromodulation is mentioned. See, consider neuromodulation. That is the question when you can go for that. If it is having neuromodulation. Severe pain persists. That is the question. Severe chronicity. Okay, answer is pain. Pain is the answer. Not dystonia, it is pain. Pain is the answer. Either random conditions on you can consider either that or this. In which stage? If you have severe pain, so answer is pain. Okay, yes. Severe Roshna, because Instead of severe, chronicity is already mentioned. Anomaly in the പറയുന്നുണ്ടല്ലോ, that means severity. Okay, so that you can write just pain there. Answer is just pain. Okay, 13th one. When do the symptoms of CRPS usually onset following an injury? So my keywords: when, symptoms, injury. Yes, definitely you need എന്ത് വേണം അവിടെ, the time indicating word, otherwise your answer is wrong. When, അതാണ് എനിക്ക് അറിയേണ്ടത്. When. What is the time indicating word there? When do the symptoms of CRPS usually onset after an injury? എപ്പോഴാ? The keyword I've seen here, symptoms of CRPS typically start when? Within 4 to 6 weeks. This is the keyword, after an injury or fracture or surgery. So answer is within 4 to 6 weeks. Yes. ഇവിടെ നിങ്ങൾ within 4 to 6 weeks. If you're writing like this, your answer is wrong. Why? 1, 2, 3, 4, 5 words. So please do cut it. Okay, within, എങ്ങനെ എഴുതാം? 4 to 6 weeks. You can just put that figures there, okay? Don't write the word. You can write it in figures, 4 to 6 weeks, yes. അല്ലെങ്കിൽ 4 to 6 ഇങ്ങനെ എഴുതാം, ഹൈഫൻ ഇട്ടാൽ മതി instead of 2. Okay, so answer is within 4 to 6 weeks, yes. Okay, Ezekiel, you can write, figure there. Instead of 4 and 6, you can write the numbers 4 to 6. Okay. Yep. 14th one. Who is occupying the central nervous system? So, who is occupying? Who? Central nervous system. Yeah. So, what is the answer? Central nervous system. So, something related to brain, right? Any answers? Who is occupying central nervous system? Yeah. Answer is brain and spinal cord. Yes. Where is it mentioned? Brain and spinal cord. Your central nervous system consists of your brain and spinal cord. See, answer is brain and spinal cord from text A. Okay. Don't put a comma. Okay, Amy. Your answer is actually correct. Amy's answer is correct, but don't put a comma. ഇങ്ങനെ എഴുതുവാണെങ്കിൽ correct ആണ്. You can write like this. Brain, then spinal cord. You can write like this. Okay, just write brain, a space, spinal cord. Don't put a comma. If you guys are putting a comma, that means it is separated. Either it is brain or spinal cord. അങ്ങനത്തെ മീനിങ് വരും. ഒന്നില്ലെങ്കിൽ brain അല്ലെങ്കിൽ spinal cord. അങ്ങനെയല്ലല്ലോ. Brain and spinal cord അല്ലേ. So, answer is brain, a space, spinal cord. Okay. Yeah. Then, 15th one. Since the symptoms of CRPS usually improve over time, it is easiest for healthcare providers to dash it in the early stages. A very direct answer. But it is quite difficult to find out. I don't know whether you guys remember that. If there are bullet points mentioned, majority of the questions will be from the bullet points, right? So what are the bullet points? Text B, we have certain bullet points, as well as in text D also we have bullet points. Yes. So what about 15th one? Either bullet point la. It's in text B, right? Yeah. See the last one. Since the symptoms of CRPS usually improve over time, the easiest for healthcare providers to diagnose it. Okay, answer is diagnose. Diagnose on a direct answer. To healthcare providers to diagnose it. Then 16th one. Your dash relays information from your brain and spinal cord to your organs, arms, legs, fingers and toes. Yeah, already we have dealt with this kind of a question, which is in text A, I remember. എന്തായിരുന്നു text A ല് your arm, leg, hand or foot, or second paragraph, second line, your peripheral nervous system. Yes, peripheral nervous system relays information from your brain and spinal cord to your organs, arms, legs, fingers and toes. Okay, so answer is peripheral nervous system. Yes, 3 words. That is the answer. All right. Then 17th one, difficulty in urinating or incontinence are some of the dash that are termed as the complications of CRPS. So difficulty, then dash, complications. Yeah, of course, complications mentioned in text study we know. So where is difficulties mentioned in text study? So these are the complications, issues mentioned. Yes. Edana. Yes, Amy, Ezekiel, Jissa, Roshna, Megha. Yes, Binila. Peripheral nervous system. So what about question number 17? What about question number 17? This particular complication. Okay, so what is the complication mentioned here? A lot of complications. So keywords mentioned difficulty urinating or incontinence. So answer is urological problems. Okay. Not urologic problem. We have a tendency to write urologic. No, urological problems. Okay. Urological problems. Then 18th one. CRPS is usually treatable and more commonly affects dash than children. So CRPS treatable affects dash than children. Of course, ഇവിടെ ഒരു population ആയിരിക്കും, particular population, maybe adults. ആണോ? I have no idea. I'm just, guessing. Yes. Okay, it's adults, അല്ലേ? From text A. Adults അല്ലേ? Yes, it's adults. Yeah, here. More commonly affects adults than children. So answer is adults. Yes. Okay, and second last one, series of 3 to 6 sympathetic blocks plus physiotherapy is needed if the diagnosis sympathetic block shows dash. Series 3 to 6 physiotherapy. Yeah, so 19th one, very good Ezekiel, good response. It is quite difficult to find out, but still you identified, very good response. Okay, diagnostic sympathetic block angle, if you have series of 3 to 6 sympathetic blocks plus physiotherapy, then that is a good response. Alright, then the last one, 20, CRPS causes dash including nausea, vomiting, diarrhea and symptoms of IBS. So what about question number 20? Yeah, yes, Megha, Amy. Yes, Roshna, Dissa, Anju, good response. Yes, good response. What about 20? Gastrointestinal problems, which is mentioned in text D. Okay, gastrointestinal problems including nausea, vomiting, diarrhea and symptoms of irritable bowel syndrome. So answer is gastrointestinal problems from text D. Yes, very good. Yes, Binila, Jissa, Ezekiel. So anyone with 20 out of 20? On the comment DMO, anyone with 20 out of 20 for this part? No. Okay, so let's deal with another self-prepared material tomorrow as well as a sample question from part B. Please, 19, can you explain it? Yes, make a series of... Okay dear, 19th one, what are the keywords? Series of 3 to 6 sympathetic blocks plus physiotherapy is needed if the diagnosis symptomatic block shows dash. Diagnosis sympathetic block shows dash. Avade endakya kanikkunna actually? Good response and poor response. These are this diagnostic sympathetic block shows. Adu rendu valle kanikkunna. Ini, what are the other keywords? Series 3 to 6 sympathetic blocks, physiotherapy. So answer is good response. All right, Ezekiel, you need a tough material, right? Definitely I'll create one. Okay. 18. Okay. Yeah, pretty good, but yes. Anyway. So that's that. So thank you. Take care. Good day.